Well, good afternoon, everyone. I am Cynthia Carter-Perelliot, the CEO and co-founder of the AC Care Alliance. We are located in the state of California, both Northern and Southern California. So this wonderful lab is being sponsored by the Sherry and Les Biller Family Foundation. And we have our wonderful CEO, Audrey Haberman. Would you wave or say hello with us today? Absolutely. So we're thrilled to be here. Just a little bit of information before we start this wonderful session. So our organization, the AC Care Alliance, has enjoyed a partnership with Sherry and Les Biller Foundation for several years now. And I'm really proud to say that they have been an incredible and true partner when it comes to working together for making a difference in our communities. But when it comes to serious illness, and that is the intersection of both of our works as organizations, we've made a lot of strides in terms of treatment, but we don't often see the help that people need as it relates to caregiver support, as it relates to managing medications and all the things that go into the support that people need and caregivers also need. And these are the things that really make a difference, like goals of care, right? The conversation that people need to help them decide what exactly is best for them. Understanding insurance bills and getting financial support. And so the notion of the holistic approach to care is really what this Ideas Lab is all about. And you're going to hear from incredible people here today. But we need to do more to help our communities who have been mistreated and understandably don't trust the healthcare system. Now, there's a lot of research and data that show that if people that have serious illnesses and their families get the wraparound support that they need, they literally have better health outcomes, better quality of life, and it saves the system money. So that's what the Biller Family Foundation is trying to change in cancer treatment and eventually all serious illnesses, particularly focused on supportive cancer care. And this, folks, should be a national health standard. Can I get an amen? That's right. When people have access to supportive cancer care, it reduces emergency room visits, hospitalizations, and healthcare costs and improves outcomes. So I want to just give you some quick statistics. Every 10% increase in utilization of supportive cancer care translates to $4.6 billion reduction in annual health care costs nationally. Amazing, right? Only 15% of patients utilize these services, and a staggering 61% report never even have heard of supportive cancer care or not being sure of what it is. And so the Biller Foundation has developed an incredible national coalition. We refer to ourselves as Together for Supportive Cancer Coalition, and we're building a national movement to raise awareness and increase utilization. And very specifically, this is a multi-sector coalition that is creating links between communities, resources, and expertise. So, on behalf of the foundation, thank you for bringing your thoughts, your presence, your beauty, all that you are to this important conversation. We are here to make a difference.
All right, well, thank you for those words. In today's session, we are going to take about 25 minutes to have a panel discussion, so we will hear from our panelists. We're then going to break out into 4 pods, so you can kind of just take little quadrants of this room and break into 4 pods, and you will have a discussion amongst yourself in finding solutions on what our panelists are speaking about. And then we're going to share that. We're going to take about 15 minutes after that to share out of each group your one big idea, and then as a whole, we will come up with a 5th big idea that we will turn in, and then we will wrap up our session. So at this point, I am going to turn it over to our moderator, Dr. Tabia Henry Akintobi.
There it is.
I had to say it in my head, sorry. All right. So thank you.
Wonderful. Well, so glad to have you here to hopefully inspire some ideas from our panelists. As I introduce them, this will be the first and the last time that we will be using last names. We want to get intimate, get comfortable, and begin the conversation. So one of the things that Cynthia raised, just to remind us and frame this discussion, is good health and well-being are the foundation for thriving societies. We also know that people spend likely over 95% of their lives outside of a doctor's office. So it is so important that we think about health as not just being in brick and mortar, but it is how people navigate health, how they navigate health care, and making sure that we give people what they need in the amount that they need it so that they can live their best lives. And that means all of the systems and structures that contribute to optimal health or not. So in thinking about that, I'll introduce the panelists and we will dig right in. So Reverend Cynthia Carter Pereliet, she is co-founder and CEO of the AC Care Alliance, or ACCA, or maybe ACA, depending on how.
Yes.
Right, there it is.
That'll work.
A community-based organization in partnership with clinical, academic, and community organizations. The organization engages over 50 faith-based organizations and their pastors across 6 California counties, including San Francisco and Los Angeles. And the rest of her bio is in the program, and she may share a bit more of it as she answers some of the questions. Ted Ketsios, he's Senior Vice President of People Care, Cisco Systems Incorporated. Ted is the Senior Vice President of People Care, part of Cisco's People and Communities organization. Leading across global compensation, benefits, crisis response, and people experience, Ted steers the development and delivery of world-class solutions that support the essential life needs of Cisco's 84,000 employees in almost 100 countries. Absolutely no pressure, Ted. No pressure. All right, and finally, last but not least, I am so excited. We already talked about some work that we need to do. Cami Wolf-Rice, she's the author of The Flight, My Opioid Journey. She is also the founder of CWC Alliance. Cami's journey is one of turning pain into purpose. After losing her son Christopher to opioid misuse at just 32 years old, she channeled her grief into action, founding CWC Alliance in 2018 and published the book, The Flight, My Opioid Journey, in 2022. Through the Alliance, she created the Life Care Specialist role, a first-of-its-kind position in healthcare to address the critical gap that failed Christopher, making sure patients receive trauma-informed pain management and substance use prevention as part of their care. So you all, we have a rich cross-section of perspectives, and we have an even richer room representing your lived experience or those of your organization seeking to make communities healthier in all the ways that it matters. So I'm actually gonna start with Cami. The CWC Alliance, Cami, has created a new position in hospitals. Can you tell us why and what the role of the life care specialist is?
Yes, thank you, Tavia. Well, as I said, turning tragedy into triumph is what we're all about, and taking that pain and making it into purpose. I felt like if you look at our society, we have coaches for everything. Imagine watching a football game with no coaches on either side. But when you're in a healthcare crisis, you have no one at patient bedside to coach you through that crisis. And Christopher, I basically built this position on everything I felt like my son didn't have in the multiple times being in the hospital and what I did not have as his caretaker. So why not pick the hardest thing in the world to do? Let's get a new position in hospitals. However, my son's driving it, and we are at Grady, we're at Emory, we're at multiple rural hospitals. We've just done our first out-of-state in Arkansas. My North Star is to have life care specialists across the nation in every single hospital. And their job is to educate you if you are taking an opioid, there is a time and a place, but you need to understand how quickly you need to taper off those opioids. You can become addicted. Your brain can be hijacked with
Yes.
one prescription.
Yeah.
All the life care specialists have a toolkit full of pain management coping skills. There are so many things you can do to divert pain in your body without using an addictive substance. So we're there to teach them pain management techniques. And then there's the mental side of being sick. You have anxiety, stress. So we're all trauma informed, and we teach coping skills to deal with the mental side of healing yourself. So I could go on and on and on, but I'm going to keep it short, like I was promised to do.
I so appreciate that. Yeah. One thing that I hope we all are clear on is that there is absolutely no health without mental and behavioral health. I will say it again. There is no health without mental and behavioral health. So hopefully through this session you will be reminded and inspired to action as we continue to socialize that in whatever way that health and healthcare shows up. So good segue to Ted. What models are most effective in integrating supportive care and mental health into mainstream health systems which typically have not integrated or socialized the importance of them?
Yeah, hello everybody. How are you today? I have to start out with that. I love this room. All right, so effective models. You know, I'm going to take this approach from a corporate workplace perspective, given that I come from Cisco. And I think it really starts with, like, what's the problem that we're trying to solve? And the problem that we're trying to solve is, you know, there's a lot of, mental health leave of absences are up 300% since the pandemic. If you really look at mental health disorders, 50% are actually stress-related in the workplace. So there's some really good data out there that sort of like lights a fire under us in terms of what we need to do to address that. In terms of these models, we've approached it from many different angles. We've approached it from an angle of how can we partner with our healthcare partners more effectively. So the things that we did was we worked with them on breaking down some of these barriers, especially when it comes to caring for mental health. So what we did was, one of the solutions was we made our out-of-network, so you have in-network providers, out-of-network providers, we made them the same benefit. So we broke down the barriers to make sure that people can get access, because access is the really big issue. Another thing we did is we really look at it from a patient-centered medical home model. We try to drive integrated care so that it's not just one doctor not talking to another, they're all talking. And there's some great solutions out there, great companies that are doing this both virtually and physically. I think the other thing we do is we sort of broaden our aperture on this, and there's some really great healthcare companies that analyze data. They have great databases, and all protected data information, decrypted information, and they look at social determinants of health. So they'll look at those non-health factors that lead to health outcomes. Things like income, education, lack of transportation, lack of housing. And what we're able to do is to partner with them on identifying those areas and geographical areas, and then what solutions can we put in place to target those underserved populations. So it's another thing that you can do. We approach it from a leader perspective. We just started piloting what was called an accelerator boot camp. We took our directors and above, and we take them through a training on how to actually lead with empathy, lead with care, and how to actually help people, how you can identify what needs there are and get them to the right resources. Yeah. So it's another solution that you can look at where it comes to leaders. And then another one, in Cami, with your life care specialists, what really triggered on this is we have what's called an Wellbeing Ambassador Network at Cisco. And what we're trying to do is how do you scale across 84,000 employees? Well, you need to use your employees. So you have to be careful. You don't want to create too much training because you want to leave those in the hands of the experts. But what these ambassadors do is they take certain things and they're able to motivate employees and inspire employees to actually care for themselves better. It could be movement, it could be getting the right resources, it could be getting the right resources on opioids, different things of that nature. So we're trying to leverage a network of employees to really be out there with our employee population. So those are a couple of the effective models.
Wonderful. Thank you so much for that. We are clear, I think, across us and you that the experts are not only in the academy, they're not only in the clinical space, and across the data that we capture and all of the social and systems determinants of health that we want to address. If there is no trust or trustworthiness, it is for naught. And we're also clear that trust and relationships actually are correlated to better experiences, satisfaction, and ultimately, we hope, to better health outcomes. So, we hear this term that, we're working in silos. I feel that for the most part, people are not intentionally working in silos. They just have lots of hats on and are trying to get their work done. So spaces like this, I think, allow us to be able to play and ideate together as we think about the path forward and working across expertise areas. And so the question for you, Cynthia, kind of steers us in that direction. What do we need to do to see? What do we need to see in terms of expansion of partnerships in the nonprofit and corporate sectors to more fully engage the strength of the for-profit world for deeper community-level long-term sustainability? So what is the partnership value proposition?
That's a loaded question, isn't it? First of all, we need to do more of what we're doing here today.
Yeah.
I've truly been inspired already, Cammie and Ted, your various models. It's really important for us, first and foremost, to see one another as human beings. Can we start there? It's important no matter what your background, your ethnicity, your gender, no matter where you come from, you are a human being.
Yeah.
And so we want to approach the work when we talk about working across sectors, both public, private, religious. We need to see people as people. Think about them as you would your own family member or relative or someone that is near and dear to you. And so I think it's really important for us folks, first and foremost, to see one another at a level that says, I respect you. I respect where you're coming from. That is a starting place. And I have found in the work that we're doing at AC Care Alliance, and we have had the blessing and the benefit of working not only with the faith-based community, we work with corporate organizations, we work with the civic population, we work with government, we work with academics. They are our evaluation partner, and therefore we have an evidence-based model through the AC Care Alliance. What we found is we've approached people from the level of professionalism, mutual respect, and the belief that they too are human beings. And when you share your own personal experience, Cammie, my story isn't quite like yours, but I got involved in this work as a result of my father having end-stage prostate cancer that had already metastasized to his bones when he first went to the doctor. He looked like a picture of health. But what I found out as a result of that negative diagnosis, that if you are a person that really believes, and that means different things to different people. For us and our family, our faith played a huge part in the fact that Dad's 8-month diagnosis turned to an 8-year survival, thriving experience. I have a background in corporate technology, but I am a believer. And so what I saw, an opportunity when my dad was down to that last 6 months of that 8-year prognosis, was to really look at the full picture and say, number one, there's a huge opportunity here. Because what we're seeing is that, I gotta be honest, in a very highly dominated male Caucasian healthcare system that my dad was involved in, they didn't understand what we were saying. They didn't understand when we wrapped around the bed and had prayer and sang songs. They didn't understand that. And I'll be honest with you, we felt insulted in a couple situations. But coming from the perspective of wholeness and humanity, I saw the opportunity and my mom to talk to the medical professionals and even the administrators of the hospital and speak our truth. And the work that we're doing today with the AC Care Alliance really focuses around how do we build coalitions? How do we build these partnerships across sectors and address people as human beings? So how do we do it? We start by, I have to say it again, do like we're doing here today.
Yes.
Number two, to help address the fact that we all are human beings. Sometimes, folks, that might be the first sentence you want to use when you talk to a health professional that doesn't seem to quite get where you or me might be coming from. Humanity, number one. Mutual respect, number two. And then always, always honor who you are holistically. Bring it all to the table.
I love
That's
that.
what I say.
We need a hand for that. So Cammie shared something that I think really bodes well with what Cynthia just said. And it speaks to this notion of the fact that we are human, and that is the place to start. So perfection, I'm just adding a bit to what you said, is absolutely not required. We are here to collaborate, and we are also hopefully here to act. And what we also, I think, are saying is that there are some tenets of relationships and partnerships to address the health of communities that are evergreen, meaning irrespective of time and technology, they still hold true. The humanity of each of us, the importance of respect. I would also add that bi-directional or multi-directional benefit is also important. We have to be coming to understand each other in ways, and that intimacy and trust is not only when there is a deal on the table, it requires an investment of time to figure out what Cynthia values, what her organization values, and also what Ted might value. That social exchange keeps us in relationship whether there is funding or not, because we are mission and vision aligned. So these values and tenets definitely hold true, but there's some things we really do need to get with because the times require it. And so, Ted, I'm gonna ask you this. How can emerging technologies, with all of the things that we see as values and behaviors that we want to have remain, how can emerging technologies like AI, digital health platforms, and wearable devices transform prevention and early detection?
Yeah, so it's a loaded question, I think. I'll start with, if I were to use AI and type that probably into ChatGPT, it would give me an answer that says something like, analyze patterns of data across multiple data streams, right? Lifestyle, genetics, labs, scans, wearables, integrate that data and be able to identify risks before they occur. That's sort of the ChatGPT probably answer. The way that I would answer that, and again, bringing in sort of a corporate workforce, is we think of sort of addressing those things around how this combination of emerging technologies come together in the flow of work. So in the flow of work for us is, how many of you use a collaborative platform like Microsoft Teams, WebEx is Cisco's company, so what we're trying to do is build solutions within that flow of work because people are communicating either through meetings or messages all day long. So our journey started about 2.5 years ago, and what we decided, and this was before AI, we decided to experiment. Have a pilot with regards to, we built a WebEx app with a partner of ours to where it asks you daily questions about your well-being. So to ask a question around, how are you managing stress? Are you managing your boundaries around stress? Like, how are you doing? Did you sleep okay? So it's asking you questions, you would type in an answer, and then it would give you a resource of how to look at it. It would comb the database that we have, and it would give you content that would be applicable. So it could be sleep tips, it could be a benefit that we offered, from expert medical advice. So we tried to approach it from that angle around in the flow of work building. Well, now with AI, we have to get a lot more sophisticated. And so we have sort of our own internal AI engine. It's called Circuit at Cisco. And what we've done there is built sort of a HR, what we call a HR assistant. And you can actually use that. So for this upcoming benefits enrollment, it ingested all this data around our benefits. And if I prompted it and basically said, I need help with an aging parent, it would give me the resource applicable for that. So for us, it's around using AI and trying to bring information real time to people to help them proactively address what they're doing. Because that's what I think. You have the reactive way and then you have the proactive way. The proactive way is being able to prompt them with information. And our vision is to actually push information to them. Once we have information, be able to give them the applicable information to meet their diverse needs. So that's how we're addressing it at Cisco.
Great. The lived experience that you have moved to your passion, your purpose, and your organization, Cami. Talk a little bit about how your organization also fights the fentanyl crisis with youth.
Yeah, it scares me because when I talk to parents and they don't know what Narcan is, it makes my heart just, I can't explain it. There's a fire inside of me because I lost my son at age 32, and then 2 years later, right after COVID, my brother had high anxiety. He ran out of his Xanax. Friend came by, gave him one Xanax, had fentanyl in it, and I lost my brother. So I understand my calling very clearly of what I'm here to do on this earth. I'm here to fight the opioid epidemic and the fentanyl crisis. And so, I got naloxone right here, okay? And this is what I want. I want everybody to have this. And if you think, oh, well, it's not going to be my child, okay, well, maybe it's not. Maybe it's going to be your child's best friend. Maybe it's going to be your neighbor. Maybe it's going to be somebody in a coffee shop or in an airport because they got a fake pill. Yes. It's in Adderall. It's in Xanax. It's in cocaine. It's in everything. And let's face it, people have been experimenting with drugs for hundreds of years. The difference is you don't deserve to die because you experimented at a college party or someone gave you an Adderall to stay up to take a final and it had a speck of fentanyl in it. It's the #1 killer in our country, age 18 to 45. There's been more people die of all the wars combined in the US, all the wars and all the deaths, there's been more deaths with fentanyl and the opioids. I don't think people are aware of that.
Right.
And so we just received opioid settlement money in the state of Georgia. We are launching across the state. We're working with youth organizations like the Boys and Girls Club, Usher's New Look. Usher, I chair his board. He's had a youth charity for 25 years. And the secret sauce to this is you empower our youth, and you have the youth train the youth.
That's right.
Because they're not going to listen to us, but they will listen to their peer.
That's right.
So we pay kids as a job to learn how to be a health advocate, and then they go out and teach the other youth. And that's the secret sauce, in my opinion, is to really empower our youth. Because, and I'll talk to kids, and I'll take a packet of sugar, and I'll pour it out, and I'll say, if this is fentanyl, all 500 of you would be dead right now. Because they need to understand how dangerous it truly is. And you don't want to do the fear factor, but at the same time, you've got to, and I tell them, look, it is not your fault. You didn't start this problem, but it's up to your generation to fix it. So I'm really excited about the Youth Prevention Network. Obviously, I'm super passionate about it because I do not want anyone else to have to bury a loved one.
Thank you. Thank you, Kim. So as we turn the corner towards you all thinking about your ideas and how we may have helped to pepper and salt a few ideas to go with your amazing ones shortly, I want to leave the last question for now to Cynthia. In the current national dialogue, the words or the acronym DEI have unfortunately become triggers for challenging conversations. What are your thoughts about diversity, equity, and inclusion as it relates to whole person healthcare and its relevance?
Once again, a loaded question.
Yep.
But a tremendously important question. I think this notion of diversity, equity, and inclusion obviously has its deep importance for us particularly people of color. I would also say that it's important that we recognize that when we talk about communities of color, we're talking about deep inequities when it comes to healthcare. Every possible disease state in Black and brown communities have higher numbers in communities of color, particularly the African American community and more the Latinx community. That is a reality. You can put any name on it you want as it relates to addressing the problems of having enough people within systems to make a difference. The reality is these inequities have many years of data and research that supports exactly what I said to you. So what do we do in this moment? What do? We keep working. We keep being intentional about wraparound support services for people that the data shows makes a difference in a person's longevity and their quality of life. We keep working. We keep focused on making a difference with every single individual that we have the opportunity to engage in, no matter what level. Once again, respecting them as human beings. I have to say, given some of the things that we're seeing in this nation currently, I think the tide may be slightly turning. What does that mean? It's like my grandmother said, things won't always be this way. And when things turn, and they will, what will we do? Where will we find ourselves? I would propose to you that we keep our focus, that we continue to respond to our callings, because what I've heard from our panel, what I've heard from our doctor here, and I'm looking forward to hearing from you in our conversations, we've been called to do what we're doing.
Yes.
We wouldn't be in this room if we were not. So let's keep focused on our calling, keep connecting to one another in deep partnerships and relationships, and honest and sincere communications at every level. Every level. We need corporation. We need business. We need what you all are bringing, Ted. We need each other. So I would say, don't worry about the acronym. Keep doing your call and do the work.
That's right.
Like that.
I hope you've been inspired or reminded of the importance of partnerships. We have to have evidence-based rigor. But at Morehouse School of Medicine, like many of you, you can have high touch in relationships, and you can have an evidence base to demonstrate that your work not only has been effective, but that it matters.
Yes.
How y'all doing today? What's our team name? What's our name? What's our team name?
World Transformers.
The World Transformers. So
now all the other teams are thinking.
our main solution is to create a community health coalition, right? And this can be in place in every single state, right? Some of the main things that we want to address is, of course, affordable care for those who particularly are in need, right? When we think about equity and we think about equality, those are two different things depending on how you're looking at it and then what resources specifically that you need from that, right? So we want to focus on that. We also want to focus on nutrition and food access and care as well. Right? So when we think about the social determinants of health, depending on what area code I'm living in, I'm either susceptible to having a Publix next to me or being next to a food desert. So we want to also really focus on that. So we're looking at labeling of different foods or different things that's in there. We're looking at water resources or water access, how much ultra-processed foods are in my neighborhood. So we want to have that as well. And then lastly, for our last point, we want to utilize some of the local spaces that we always congregate in, or we usually congregate in. So these are churches, these are barbershops, these are places where a lot of people come together and share different community ideas and also fellowship as well. So those are the 3 points. Don't really know where a lot of the funding is going to come from, but when we look at partnerships, we look at collaborations. We turn to our grant writers, right? The funding will always be there. When we look to our volunteers, and when I speak about our volunteers, me being a master's student, a lot of us, we don't do this for the check. We don't do this for the money. We do this for the cause because we have purpose behind us, right? So we have to expand and exert our, not only our passion, our mission, but look into our network so we can go ahead and bring those people up front who are answering the call. So that's my point.
Got another group up next.
We're the illustrious wellness team.
Yeah. Come on.
Good afternoon, everybody.
Good afternoon.
All right. So we wanted to tackle this across different modalities. So the first area was rural access. So we wanted to be able to use larger publicly traded companies, for instance, like Serve Robotics, to help infiltrate rural areas that can go and deliver support, whether that's delivering medical devices, medical products. And on the backside of that, also expanding of knowledge. So being able to also use different robotics and AI to be able to expand knowledge into different areas, but also make it very context driven. For instance, some area codes, even here in Atlanta, have a higher expectancy within the same city. People who live in Midtown have a longer life expectancy than people who live in Southwest Atlanta. So making those very contextual. On the financial wellness side, in hospitals, being able to expand financial advisory or counseling services that are also trauma-informed to be able to work with families and also be able to educate the staff. And then also on the mental wellness side, really focusing on preparing healthy leaders to enable that trickle-down impact in their organizations. Obviously, if you have a leader, and I've been in the same exact situation myself, when leaders lean into talking about mental health and physical health, it makes an open environment for their team to be able to come to them, trust them, be able to take leaves of absences without feeling shame. And then on the prevention side, having agents to integrate data from different wearables to basically be able to send your data to your doctor in a private, encrypted, tokenized mechanism. So that would also be very context-driven. And we really dive deep into this one by being able to highlight, obviously, data privacy is very important with this idea, being able to create localized data analysis for people to be able to basically own their data. So that they can only share basically a one-time token with their doctor to have access for speedy diagnosis and intervention. On the policy side, we really wanted to look at the 40-10, basically expanding Medicaid coverage across the nation, and then also expanding minute clinics into rural popular stores. Like obviously we know we have CVS, different Walgreens, but we also want to be able to target Walmarts and other superstores that are in those areas. Even if there are food deserts, there are stores in those rural departments. And then the other thing is also, on top of policy, would also be creating more holistic wellness options. Right now, insurance companies don't necessarily support holistic practitioners in the same way they do traditional medical professionals.
Right,
So we
right.
want to be able to provide different coalitions that can go out and provide other forms of medical care to people where they need them.
Thank you. As the next group comes up, I want to be sure we capture the whole issue of financial wellness and knowledge. So next to knowledge, financial wellness. Oh, you have it there already. And then the issue of AI and wearables is connected to technology. Wonderful. Who's up next?
When you say wearables, can you elaborate on that? When you say wearables?
I'll ask the one who brought it up to bring it. Do you want to? Someone else in the group? You would be the one to. I remember you. Yeah.
So I'm sorry, what was the question?
Wearables.
Wearables.
What does that include?
What is that?
Yes, he's our expert. Come on.
So sorry, I wasn't expecting to speak. So, so
Do it.
the idea was that everybody has an Apple. Well, not everybody. People have an Apple Watch. They have the glasses that you can wear. All of them are these different parts of technology that we use that keeps track of our health, but they don't talk to each other. Like your Apple Watch doesn't talk to your Meta glass, and none of that talks to your EMR, right? So the thought process of it was have everything interconnected, and then have that be able to be sent to your EMR in real time, and you have your own, basically your own personalized EMR with your doctor that your doctor can analyze. It's an encrypted system that the encryption is done by you, so it's basically your fingerprint, your retinal scan, whatever it is, and you would be able to just associate it with your doctor, and then you could give privileges on a tokenized scale. You know how everybody probably use like Apple Pay and everything? It does by token, right? So it doesn't send your credit card, it sends a token. And then you just send that token to your doctor, and then your doctor is able to say, okay, I need to see it. And then the token expires. If they need another access, you gotta give them another token.
wow.
So that's how it does the,
That's,
that's it.
thank you. Thank you for that. Which group is next? And while the next group comes up, Donna, thank you. This is rapid fire, rapid response, and capturing everything, so we appreciate you. Come on up.
Everybody.
Hi.
I am representing the Glory Builders.
Oh, wow. Love it. I love that.
One of the things we agreed about was the importance of communication. I think the panel made that very apparent. Doesn't matter what segment we're in, if we're not communicating in a way that helps the communities we intend to serve, we're back to ground zero. And so we talked about, first, communicating throughout the different communities we work. Make sure they know what services are available to them. And the second thing is to remember our purpose in the work that we do and apply that in our work. Be aware of who you are, and remember that being human is about trustworthiness and honesty. The next thing we talked about is advocacy and fact-based education.
Oh, wow.
Just like Cammie said, you know, when she pulled up that little Narcon thing, I was like, oh my God. But you know, it's important that we not just educate our communities, but it be rooted in fact. So that was another important thing. And also, we talked about the need for continued advocacy. We have to find a way to be directly involved in our communities to help them build resilience, to train them so that they can know what they need to do to stay healthy, because that's what this is about. We have two more things. I'm coming. The last one is this. We talked about this earlier, and I just want to close with it. We have to develop partnerships across systems, cultures, and faith traditions to further break down barriers.
Yes.
Yes. Wonderful.
The last but the best. And we are the truth seekers.
Okay.
The AI truth seekers. I'm going to keep it short. From our other colleagues, we want to just piggyback off of you. I thought those were some great solutions and ideas that we need to do in our community. Our group's solution focuses on 3 simple but powerful actions. First, creating respectful conversations where every profession's perspective is valued. Secondly, developing an AI app for the community, not just for the doctors, not just for, teachers or companies, but for everybody, inclusive, that provides evidence-based healthcare answers to stop and misinformation. And third, encouraging people to share their stories. So important. We resonated. I didn't know what, you want to say what that word again was?
Narcan. Narcan. Narcan.
We got to tell our stories. It is so important that we share our stories with our children, not kids. Kids are goats. I'm an educator. My 98-year-old grandmother, children, students. Think about it. If you called your child a kid, or if you call them a student, which one sounds better? Student. My students are as young as 3 months sometimes. And we have to start from the womb. If we're gonna, if our children are, what's the word? Inundated with having an addiction with technology, it's because we gave it to them. So we have to take it back. We have to take back our power. We have to stop. We have to eliminate the technology addiction by just saying, or giving a balance. And I'm going to stop because I can ramble on. So I thank you.
Thank you.
And let's all be truth seekers.
Truth seekers. Okay, wonderful. We got all the groups. Collaboratively. Okay. All right, so thank you all for all of your rich feedback. Give yourselves a hand. So many. What you? You all heard a lot, and there were some some themes that crossed a few of your areas. If you were to think about a fifth, and it's always nice to see others on the what's included there, so you can take a moment to see what might not be missing. So quickly, there was community health coalitions. There was discussion about socializing community responsive AI and digital technologies. The issue of advocacy came up. So there's some action-focused items, and there's some things that to me sound like values, right? So values are the things that inspire the way that we move and the way that we behave. Respectful conversations, the humanity, and remembering that all of our wisdom should be equally valued as partners, right? Is there anything you don't see there? We'll start here, and then we'll come to Cami and any others that want to share. There's a few in the audience. We're gonna have a few final reflections. Please, sir. What's not there?
I would say policy implementation.
Go ahead.
I would say policy implementation. When I see all of these, I believe these are all great ideas and these are all effective ways to help solve a problem. But how are we tracking and gathering the specific data to give to specific legislators or advocates to reform policy for us? We have a fentanyl epidemic that's going on, but what policies are being implemented to restrain or add barriers to illegal drugs coming into our specific communities and our country?
Great.
So when I think about AI, what policies are being implemented to help fund some of these things in which it makes sense to being implemented within our hospitals and things like that. So I just see the lack of policy advocacy and a roadmap in which we could better reach some of our legislators and advocates.
So with all of our doing and advocacy, ultimately, we want to affect change through policy. So policy, there should be a policy lens, a policy and action lens. What else is missing as we wrap up? Thought there was another hand.
There was.
Someone's coming. Don't look at AI. Don't look at AI. I'm playing. Okay, one more and then we're going to close. Please.
I didn't see out of the fear, like when you share this information.
Yes.
The fear that it's going to be used against you when you go to get life insurance. The fear that it's going to be used against you when you go to apply for a job.
Yes.
The fear that it's going to be used against you when you
Yes.
need to get an apartment and they're doing a credit check and somehow that pops out. What's protection?
So it sounds like, if I hear you right, and we're going to get some final reflections here, and that we have to address the justified hesitancy, mistrust, and fear. Yes. If we don't address that, we will not move. So I appreciate that. And we're going to have to wrap up. Any final reflection in 20 seconds or less? Anything you'd like to add as we wrap up here?
You know, it really encompasses a lot of this conversation. Break the stigma, right? How many people came up and talked to me that have a personal issue, and you all know somebody that's addicted, right, or that's dealt with something. And so if we break the stigma around getting mental health services, around addiction, substance misuse, and it ties back to being human, let's talk about it, let's communicate, but let's break the stigma.
Thank you. Ted?
Yeah, I think for me, the future of healthcare, I love the community-based care, and I love the coalitions and the connective, very big challenge. I think what each of us could do is think about ourselves and our skills around being technical, having some technical skills, being a change agent, being a philosopher, in terms of just sort of, understanding how decisions are made in a safe environment, and then leading with empathy.
Yeah,
Leading with
yeah,
empathy
yeah.
so we can have psychological safety, trust, and inclusion and guide us. So those are things that we all can control.
Thank you, Ted. Cynthia?
So much has been said. This is fabulous. You all are amazing. I want to just piggyback on what this dear lady just shared about the fear factor very quickly, because I think we've heard so much here. I think it's really important, again, that whole notion of trust and finding trusted people that can relate and tell their stories. And so storytelling, we can't say enough about that, but I also say story listening. We have to listen
That's it.
and hear what people are really saying, and then meet them where they are so that we can address and move forward. And so thank you for lifting that up, sister.
One thing, please. Recovery Church Movement. Please look that website up. Recovery Church Movement. Look it up. And it encompasses everything that we're talking about, especially with the individual, with life and moving forward. Recovery Church Movement. Recovery.church.
Thank you so much. Thank you for that. Thank you, colleagues, panelists. Thanks to everyone in the
you.
room.